Hi everyone, it's Dr. Ozzy. Welcome back to my YouTube channel. Today, I want to talk about forehead bumps because I'm getting so many DMs on TikTok and Instagram about bumps on the forehead. And then I was thinking about it, and it's true, we do see a lot of dermatologic conditions that pop up around the hairline and the forehead that many times can be a challenge to figure out because some of them look like acne, some of them, look like rosacea. So we are gonna spill the tea on the forehead. Before we get started, don't forget to rate, review, and subscribe, and be sure to turn on your notifications so you know when I upload a new video. So let's start with forehead bumps. The forehead is exposed to a lot of beauty products, hairsprays, gels. We sweat and the sweat runs down our faces. There's also a lot of things that come into contact with it. So some people wear hats, bandanas. So it comes into contact with a lot of different substances, and it also sits at the top of the T-zone. So we consider this in dermatology, the T-zone. This is where we have a lot of oil production and oil secretion. It's an area of high density of pores in that area. One of the most common things that we see is actually a yeast folliculitis. And many times people think that it is just regular old acne, but it's not. It's due to a yeast, Malassezia or Pityrosporum, that gets into our pores, and all of a sudden you see these red, they're somewhat uniform clusters of tiny little red bumps. And they can sometimes be itchy, but sometimes they're completely asymptomatic. They can also come up along the hairlines. Now, yeast folliculitis has been coined fungal acne. Probably what you know it by, it's actually not a fungus, it's actually a yeast. Not that I'm getting technical here. So what are some things that you can do to help with that? For one, a lot of times it's caused by sweating and wearing hats. And let's be honest, not all of us wash our hats on a regular basis. You should be washing it once a week, at the least once every 2 weeks, because we get a lot of bacteria and yeast that can build up on the lining of hats. And same goes for bandanas and any sort of fabric that comes around the head on the forehead. It's really important to make sure you're cleaning those very regularly. So what can you do to treat those? There are a lot of options. Sulfur-based products such as a sulfur soap, you can buy this on Amazon, it's like $6. You can also get a prescription from your dermatologist for prescription or medicated sulfur washes. Other things would be shampoos that are normally designed for dandruff, because this type of yeast also plays a role in dandruff and getting folliculitis in the scalp. And you can use a shampoo called ketoconazole or Nizoral shampoo, and you can almost use it as a mask. You can put it on, leave it on for 5-10 minutes, and then rinse it off. You can also use something called a detox mask, which has charcoal and kaolin clay, which helps draw out debris and oil from the pores, but it's formulated with 10% sulfur, because sulfur is great at getting these types of breakouts under better control. One home remedy, this is for all you people that love to do DIY skincare. You can take a shot glass of white vinegar, mix it with 4 cups of water, or if you want it more concentrated, 2 cups of water, but make sure you dilute this white distilled vinegar, because otherwise it can really irritate the skin. And you can do soaks on the forehead or areas that you may be breaking out with the fungal acne for about 3 minutes, 5 minutes, leave it on the skin, then you can take it off and rinse the solution off. Some people also mist the skin with the solution, and that helps with killing the yeast as well as bacteria that may be collecting there. Another little trick is if you do happen to sweat a lot, and some people do, you can dab a little bit of powder on the skin before you work out, and be sure you have clean skin going into your workouts. You can use these pads, they're called Clarify pads, and they are great at reducing any type of organism on the skin. So you can use that before or after your workouts. That helps reduce the colony of yeast and bacteria as well. And lastly, you can use jock itch cream, yes, or foot fungus cream. It sounds lovely, but that's, you know, an antifungal, anti-yeast. It's called clotrimazole, or Lotrimin is the brand name. And there's actually been a published report on this, that twice a day for 2 to 4 weeks. And if it's truly just yeast folliculitis or fungal acne, it will clear it up. The forehead bumps can also be comedonal acne. Comedonal acne means clogged pores. And these can appear as white or little tiny black dots on the forehead. They can actually come up anywhere, and you can see them in all types of acne, but a lot of times they do like to come up on the forehead, particularly this area, particularly in people that are like 12 or 11 when they're first starting to get acne, because that's how acne starts, is from a clogged pore, and then it goes on to becoming red and becoming more like the pimples that you normally associate with acne. But comedonal acne can be closed, those are called whiteheads, or they can be open, those are called blackheads, because you can see into the pore and you see that black stuff. That's the compacted keratin that gets stuck in there. It's almost like cement. So the best product for that is salicylic acid. Salicylic acid is great at loosening that debris that we get in clogged pores, and it's an exfoliant, so it helps exfoliate the dead layer off and allow our skin cells to renew. And so salicylic acid is great for comedonal acne. You can combine it with a glycolic acid, like the Clarify pads are easy, convenient to use. You can wipe down with those. They have glycolic and salicylic acid. You can use a salicylic acid wash like Neutrogena's a 2% salicylic acid wash. Paula's Choice has a salicylic acid. That works great for comedonal acne. Other ingredients are retinoids, particularly tretinoin, and then you can also use benzoyl peroxide, but you don't want to use all three because the combination of them can be a little strong. They're going to over exfoliate your skin, and that might lead to impairment of your skin barrier, which is never a good thing. That flares up everything, so stay away from that. The wash, I would suggest putting it on, leaving it on for a few minutes, and then rinsing it off. Actually, benzoyl peroxide will kill everything and anything it comes into contact with. So you can also use it if you just have all types of acne. If you're sensitive, then I would suggest doing something called short contact therapy, which is when you place the benzoyl peroxide on your skin almost like a mask. You put it on and then you can rinse it off after a few minutes. It's gonna be more effective using it that way. If you're not sensitive, you can just use a benzoyl peroxide gel, on the area. That's gonna be more effective than a wash, but it will also be more irritating. And then the last type of acne you might see there are pustules, the ones that have a red base and then they have like a whitehead, but it's not truly a whitehead. They're more like fluid-filled pustules with little pus inside. Benzoyl peroxide is really the best for that. So they're different in that they are sometimes mistaken for whiteheads, but a true whitehead doesn't really have any redness with it. This has almost like a white pustule on it. And so benzoyl peroxide works the best for that one, whether you do a spot treatment or you do a wash like Panoxyl wash. CeraVe has one called the Acne Foaming Cream Cleanser, which is much more gentle than Panoxyl. Panoxyl goes up all the way to 10% wash. And so something like that would help clear the skin pretty effectively. You can also get redness and flaking in the eyebrows. And I guess this would be considered the forehead area. This can also come up around the nose, around the mouth. That's called seborrheic dermatitis. Again, it tends to affect the T-zone because seborrheic dermatitis is due to buildup of oil and yeast. This is natural yeast that lives on everybody's skin. The yeast feed on the oils, they break them down, and then voila, you get this red flaking reaction. And so that is best treated with two things. One, an antifungal, so you can use the clotrimazole we talked about earlier. the Jockage cream called Lotrimin. You can use a sulfur such as Vichy has a 10% sulfur spot treatment, or you can use the sulfur soap from Amazon. And then you also want to use an anti-inflammatory, something that will calm down the reaction, the irritation. So I hope that was helpful, and if you or your friend have ever wondered about these breakouts on your skin, share this with your friend because they may find it valuable and useful. And be sure to comment below if you have any questions about skin-related issues that you may have, because I know not everybody has access to a dermatologist. So part of my passion is bringing valuable information to an audience that may not have access to see a dermatologist. So thanks for tuning in, and don't forget to rate, review, and subscribe, and check out my Instagram, Skin by Dr. Ozzy, and my TikTok, Skin by Dr. Ozzy, and I have a podcast called More Than a Pretty Face, so if you're into podcasts, check it out. Thanks again, guys. Thanks for tuning in.